Hello everyone, my name is Lan. Today for my environmental health video project, I'm going to be talking about the naturally occurring arsenic. So today's objectives are to learn the basic information about arsenic, to understand the effects of arsenic on environmental and human health, to review approaches for the control and prevention of arsenic contamination. Here's my contents. So firstly, we're gonna introduce to arsenic some basic information about arsenic poisoning stages, and the burden of arsenic contamination. And then we're gonna be reviewing some prevention and control measures of arsenic contamination. We're gonna be using an example of Bangladesh and then the summary and references. So what is arsenic? Arsenic is a natural component of the Earth's crust and is widely distributed throughout the environment in the air, water, and land. It is highly toxic in its inorganic form, and long-term exposure to arsenic from drinking water and food can cause cancer, skin lesions, cardiovascular disease, and diabetes. Inorganic arsenic is naturally present at high levels in the groundwater of several countries, especially in Asia. And then an estimated 114 million people in at least 70 countries have drinking water containing arsenic at levels above the WHO provisional guide value of 10 microgram per liter. According to Dr. Saha's classification, there are 4 stages for arsenic poisoning: preclinical, clinical stage of internal complications, and malignancy. So firstly, after intake of arsenic contaminated water, blood, and urine examination reviews arsenic products, but on withdrawal of it, urine becomes free of arsenic. Body tissue showing high arsenic concentrations with no apparent clinical symptoms. And then entering the clinical stage, the presence of clinical symptoms is confirmed by detection of higher arsenic concentration in nail, hair, and skin scales. 6 months to 10 years may be required for the development of clinical features. Some of the major dermatological signs include melanokeratosis, melanosis, spotted or raindrop pigmentation, etc. And then in the stage of internal complications, non-dermatological toxic features appear in addition to dermatological signs. The common complications are lungs, asthmatic bronchitis. Symptoms of clinical phase are associated with different complications as the other organs like lungs, liver, muscles, eyes, vessels are affected. Liver enlargement, spleen enlargement, and fluid in abdomen ascites are seen in several cases. Finally, if the patient can survive the stage of complications, malignancy affecting skin, lungs, bladder, uterus, or other organs may be developed. After 15 to 20 years after the onset of first symptoms, cancer can be developed. Usually they have slow progress for years, but sometimes in 6 months, malignancy can extend to neighboring glands, and in 9 months to 1 year time, patient will expire. So now let's take a look at the burden of arsenic contamination. Areas predicted to have high arsenic concentrations in groundwater exist basically on all continents, with most being located in Central, South, and Southeast Asia, parts of Africa, and North and South America. This is a map that shows the modeled probability of arsenic concentration in groundwater exceeding 10 microgram per liter for the entire globe. And here are 2 graphs that showing the proportion of land area and population potentially affected by arsenic concentrations in groundwater exceeding 10 micrograms per liter by continent. And as we mentioned before, Asia has the highest burden of arsenic contamination. Okay, now let's talk about the prevention or control measures for arsenic contaminated groundwater. The most important action in affected communities is the prevention of further exposure to arsenic by the provision of safe water supply for drinking, food preparation, and irrigation of food crops. Or we can use water with different arsenic level for different purpose. Low arsenic water can be used for drinking, cooking, and irrigation purpose, whereas high arsenic water can be used for other purposes such as bathing and washing clothes. Or we can install arsenic removal systems, either centralized or domestic, and ensure the appropriate disposal of the removed arsenic. Technologies for arsenic removal include oxidation, coagulation, precipitation, absorption, ion exchange, and membrane techniques. Education is also an important method for preventing people drinking contaminated water. Awareness rising in rural areas to expanded tube well switching, promotion of the use of confirmed arsenic safe tube wells for drinking purposes, and proper education can allow people to discriminate between high arsenic and low arsenic sources. For example, test water for arsenic levels and paint tube wells or hand pumps different colors. This can be unaffected and low cost means to rapidly reduce exposure to arsenic when accompanied by effective education. Take Bangladesh as an example. The nationwide screen revealed that in 15% of the villages in Bangladesh, more than 80% of the tube wells were contaminated. And so since 1998, several programs had been undertaken to provide different types of arsenic safe water options in the arsenic affected areas of Bangladesh. Till 2005, a total of over 100,000 alternate safe water options were provided throughout the country by the government and different national and international organizations, which covered about 38% population of arsenic affected areas. In the following years, the installation of arsenic safe water options increased by many folds, and by 2009, nearly 70,000 different types of arsenic safe water options were in place in the arsenic contaminated areas, covering about 54.4% of the population. Among the options, more than 2/3 were arsenic safe tube wells. Other common safe options were deep tube wells, duct wells, shallow shrouded tube wells, and pond safe filters. According to a 14-year study conducted in Bangladesh from 1996 to 2010, percentage of samples having arsenic larger than 50 micrograms per liter in affected districts decreased from 38% to 30.9%. And the percentage of children having arsenical skin lesions based on number of total patients decreased from 17% to 6.1%, which means that the controlling measures have made some progress in decreasing the effect of arsenic contamination. However, a recent WHO report mentioned that there are still 0.2 million people suffering the threat of cancer annually due to the consumption of arsenic contaminated water in Bangladesh, which means that further efforts from local government and help from global organizations are still required. In summary, groundwater arsenic contamination is a public health problem. Long-term exposure to arsenic from drinking water and food can damage human health and both environmental health, of course. The best way to prevent long-term exposure to arsenic is safe water supply, and there has been progress in controlling arsenic contamination, but more efforts are required, especially in low or middle-income countries, as large-scale testing can be hard for them to conduct. And here are my references. And this is the end of my presentation. Thank you for listening.